This is the Psychedelic Medicine podcast.
Hello and welcome to the next episode of the Psychedelic Medicine podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we are going to be discussing ketamine-assisted group psychotherapy for frontline healthcare workers with Hannah Cross. Hannah is a licensed clinical social worker and therapist who specializes in trauma healing and psychedelic integration, including work on LSD and psilocybin clinical trials. Now, listeners, you know I at some point was a frontline healthcare worker, and so I am very excited to have this discussion. I was thrilled when I saw this research come out. I'm excited to hear that there is more research going into the effects psychedelic therapy can have on frontline healthcare workers. So hang on for this. I'm very thrilled that Hannah has come on to discuss. Now, before we get to Hannah, just a reminder that the Psychedelic Medicine podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And one last reminder, if you are a clinician, if you are a frontline healthcare worker, you are somebody who sees patients and you would like to stay abreast on psychedelics beyond just this podcast, we invite you to join the Psychedelic Medicine Association. It is our mission to keep everybody on those front lines all the way up to date with the latest in psychedelics so that you can feel comfortable having conversations with your patients about psychedelics and referring or recommending them when appropriate. If you'd like to find out more, head over to psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Hannah.
Yeah, thanks so much, Lynn Marie, for having me. And I'm excited to talk about this project and some of the research we gathered as well. And it seems perfectly fitting that we would do so on your podcast. So, yeah, I really appreciate this opportunity.
I'm so glad you're here. Like I said, this research is very exciting to me, very near and dear to my heart. I worked for 9 years at the VA and I saw so much PTSD in my patients, but also, and I would see in my colleagues as well that hearing stories about PTSD, especially in my psychiatric colleagues, was really taking a toll on them. And then things only got worse during COVID, as we all know, very difficult on our frontline workers. And so if you could talk a little bit about what inspired this trial? What led you guys to the cohort that you use, which was frontline healthcare workers who were experiencing symptoms from COVID, and then also what led you to use the intervention that you ended up trying on them?
Yeah, so this study was the idea of Scott Shannon in Fort Collins, Colorado. And he reached out to our team here in Utah at the Cedar Psychiatry Clinics about doing this study. So we had sites here in Utah that contributed to the study, and then there were some as well in Colorado. And the I think there's was already such an interest in studying CAP or ketamine assisted psychotherapy for PTSD, depression, and anxiety. And at the time that we were brainstorming about the protocol for this study, we were also a year or so into the COVID-19 pandemic. And so there was this real obvious population that was suffering from high levels of post-traumatic stress disorder symptoms, depression, and anxiety, and that was the population of frontline healthcare workers. So, I think just the apparent problem of burnout in frontline healthcare workers was a call to action.
Well, I'm very glad you all undertook this. Can you tell me a little bit about how those frontline workers were chosen? Was it they had to be in an ER or they were in a different setting? Like what types of frontline healthcare workers were involved?
Yeah, that's a great question. And one of the things I was really pleased about how we structured this was that we had a really diverse makeup of frontline healthcare workers. So we had ER doctors, we had ICU nurses, we had therapists, we had emergency medical technicians, paramedics. We had healthcare workers that were even working more on the admin side of residential facilities that were hit so hard by COVID-19. So there was a lot of diversity in the makeup. We qualified people for this based on their levels of burnout according to the CBI, or the Copenhagen Burnout Inventory. So they had to be dealing with burnout. And then we screened them for the group. We did a medical screening, and there are some kind of medical, I guess, cautions around receiving ketamine treatments, like uncontrolled hypertension, seizure disorders, substance abuse. Currently. So we screened them medically, and then we screened them in terms of their fit for a group setting. And so that was something that I would do, or the other therapists that work on this study would do. And that's how they could get into the study.
I would love to know, as a total aside, but something that I'm super fascinated on personally, is what would make somebody better or less well suited for the group scenario?
And it's such a worthwhile question, Lynn Marie, especially where um, like we're really trying, especially at Numinous, to implement more group treatments for a number of reasons. Like, one, group treatment is so much more accessible for people. It's less expensive because the resources that you need in terms of personnel and time, like, are so much greater when you're just doing individual CAP, or ketamine assisted psychotherapy. So, like, we're really wanting to move in the direction of groups, not only for accessibility, which is super motivating to me because I know mental health treatments are largely inaccessible for most people, but also because there is this, like, I call it magic, this magic that happens in the group setting, especially when there's psychedelics on board, that really open people up to what I would call, based on some of the therapies that I offer, self energy, like capital S self energy, these qualities of compassion and curiosity that are healing. So ketamine can help people access more of that self healing energy. And when that's present in a group setting, and people are essentially able to kind of shine this healing energy on each other, there's this, like, exponential healing that I think can happen. But I went on a little bit of a tangent. Your question was, what would make people a good fit for these group interventions? And that would be, in my opinion, it would be a willingness to share, a willingness, even though there's always some nervousness, to participate in a group setting, a personality that is capable of compassion and supporting others. So, like, those are really the things that we're looking for as we're creating groups that are going to be cohesive and effective.
That makes sense. Though I also have to throw in, those all sound like you have to be a really good human to want to do this. And I want to just throw in the caveat, there's some things that make you not great for a group that don't mean you're a bad human. Like, I have compassion fatigue. And so my ability to sit and listen to somebody maybe share for a very long period of time is not great. So I'm a little afraid of groups. So just in case anybody else out there is like, oh man, I don't know that I fit into groups. And now I fear like I'm just an antisocial person. You are not. There are plenty of things. And some people's trauma may be related to groups. And so just that might make them, I'm assuming, not great for a group.
It may, and that's where, we're really wanting to interview potential candidates, because there's also the situation where someone has some, quote, trauma related to groups, but if they have an attitude and a willingness and some support from the facilitators, it might also be a hugely corrective experience for them to participate in a safe group and find that, oh wow, like, this was super helpful for me. But yeah, you're right. There are people who are amazing human beings who will probably be best suited for individual work, by the nature of what they're wanting to work on, or other, even like, if we're really wanting to work on some, like, severe trauma that might be attended to best in an individual session with a therapist, assisted by ketamine, then we might send them to individual work first.
That makes total sense. Okay. So now we've got who was in the study. Can you talk a little bit about, like you said, that there was a certain level on like basically the mental health screen was people who had reached a certain level from a burnout inventory, correct?
Hmm.
That was, and did you know anything about, or I'm sure you did, but like, what did you know about their other coinciding, maybe mental health struggles? Did a lot of them have any existing anxiety, depression, or PTSD? Like, what was the makeup in that realm?
Yeah, absolutely. So when we did an intake for the group, we are doing um, a mental health assessment and evaluation like we would, I would for a normal therapy client. And so we are looking at their whole like biopsychosocial picture and their mental health history. And at baseline, we did provide screeners assessing for PTSD symptoms, depression symptoms, and anxiety symptoms. And so those were for the most part, with most of the participants elevated coming into the study.
And then what did the actual intervention look like? How many, did they do all of their therapy in a group setting? And or did they have kind of like the MAPS trial where you have some pre-ceremony individual and then you do your actual medicine work? What did that look like?
Yeah, so after their initial screenings with the medical provider and myself or another therapist, their first session was a group session. So there were 6 total sessions. They were all done in person and they were all done in a group. And so they came in for what we would call a group preparation session. Um, the primary purpose of that is to help create a sense of safety within the group and the setting that they were going to receive their ketamine treatments in, to get to know each other. So to begin this kind of bonding between group members, and then to prepare them for the ketamine experience with some psychoeducation and just kind of painting the picture of what types of experiences they may have. And then their second session, and these were weekly, so 6 consecutive weeks, was their first dosing session of ketamine. And so, similar to the MAPS kind of protocol, there was music playing in the room, eye shades provided to facilitate this inward experience. Our participants were set up on bean bags throughout the room, and that first dosing session was a low to moderate dose of ketamine taken sublingually. And we varied the dose from person to person, but that first dose was somewhere between 125 and 200 milligrams sublingual. Um, so they would do that session. There would typically be some time for some sharing afterwards, and then they would get a ride home and return for their third week, which was a non-ketamine session that we would call an integration group session. So we would provide them this kind of platform where they could make sense of their ketamine experience and talk about it and talk about how the week went after that first dose. So, session number 4 and 5 were both medicine sessions. Session number 4 was also a sublingual session with a higher dose. And we would base that dose off of how they experienced ketamine the first time. And that dose would typically be somewhere between like 250 and 275 milligrams sublingual. Um, and then that fifth session was an IM ketamine session, and that was a high dose. So between 70 and 100 milligrams of ketamine intramuscularly. Their final session with us was another group integration session that served as a closing session for the program.
Very nice. I really thank you for the thorough, because I was like, okay, I wonder what kind of ketamine they took. Very thorough description, and that's interesting that there was a graduation both of the dose and of the type. Right. I
Mhm.
think I'm wondering, were the people in this group ketamine naive and psychedelic naive, and was that part of why the kind of a ramp up was helpful?
Yeah, yep. So not everybody in the group was ketamine or psychedelic naive. If I remember correctly, the majority were. And so, yes, you're exactly right. The idea is that with that lower sublingual dose, it can kind of introduce them to the medicine. They, if they have any fear around the experience, that's typically reduced after they have that first experience and kind of say, okay, I see what this is like. I see that I can navigate it. I see that it's helpful. And then we increase the dose from there. Now, this was, a pilot program. And so, it was experimental, and we have since, like, especially at our Cedar and Binuminous teams, have kind of reevaluated how we do that. The gradual increase of the dose seems to be a great idea, but it was also this kind of consensus by those that worked on this project that maybe not the first two sublingual, because a lot of our participants reported that first sublingual dose was so helpful for them. It was more in that like psycholytic kind of dose where they could process emotions and they could do often some verbal processing around the experience. And then that second dose maybe seemed underwhelming to some of them, or like they were hoping for more of a deeper experience after that first one. So, I don't know that everyone that worked on this would agree, but I think the conversation that we've had has been that maybe next time we would do either all IM, still increasing the dose, or just one sublingual session and then two IM sessions and increasing dosage. So we just kicked off a group CAT project this week, Dr. Robison and myself, and we've decided to do all IM for that, but we will still increase the dose over time.
It's interesting. You just said that your new thing is going to be CAT, but this one was CAP.
Mhm.
And that it leads right into what I was going to ask is how
Yeah.
many actual psychotherapists were in there? And like, because you had, I think it was 10 participants, correct, in this study?
Yep. We
And so
had
how, go ahead.
more. We had more, and are still working on gathering the data from some of them. So we actually took more cohorts through than we've published about. But yeah, you were asking about the number of therapists present.
Yes, and also just how, like, 'cause I know ketamine only takes, let's say 45 minutes to an hour and a half. And if you've got 10 people, and it's in a group, so I'm assuming it's not 10 psychotherapists. So I just wondered how the people who wanted to, like you said, psycholytic, for those who may not be familiar, we sometimes talk about psycholytic versus psychedelic. Psychedelic is like you're blasted off, you're having these, maybe mystical experience. Psycholytic is your mind is open in a way, but you're still pretty conversational and able to have that therapeutic discussion. I was just wondering what that looked like in the group setting.
Yeah, so there was a lot of therapy as a part of this project, and even in this group CAT project that we're kicking off now, there's equally as much therapy. It's interesting. The CAP is kind of like an American, like a United States kind of way, and now that Cedar is under Numinous, which is a Canadian company, they have just tended to use CAT to refer to ketamine assisted psychotherapy. So we just kind of have like a switch in the acronym there. But there was one therapist as a part of each cohort, and a prescriber who is trained in psychotherapy. So we essentially had two therapists present during all 6 sessions. Both facilitators were there. So it would typically be that we would take turns as facilitators offering different group therapy interventions in the preparation sessions prior to dosing on the dosing days, and then in those integration sessions as well. So more hours of supportive therapy or psychological support than one would spend under ketamine.
And what does it look like? So I'm just picturing, because I'm like, wow, 2 to 10 ratio. But then I think about, I've been in ayahuasca circles where there's one facilitator and
Mhm,
22 people drinking the medicine. But
mhm.
then that's hours. And so they might have time to go to different people. And like, what was there ever a situation where one person, takes the whole 45-minute, hour and a half, and they really are having an experience? And so that maybe one person is pulled and needs to work with them. And then the other facilitator has 9 people to look after. If somebody, these are just let's say I'm just group phobic. And so I'm always thinking of like, what are the scenarios that other group phobic people might be thinking of? How does that play out?
Yep. We never ran into a situation where there was a sense of, oh no, we're short staffed and people need more support than we're able to offer. And I think that the reason for that is because when you wrap a ketamine experience up in like experienced and effective therapy, there is this safety in the container that really allows people to have the inward focused journey um, under ketamine for that 45 minutes to an hour. So I'm thinking about these several cohorts that I was a part of, and only once ever during the actual effects of ketamine did somebody need one-on-one support. And in that situation, we had a participant that had some trauma resurface. And so they lifted their eye shades up and just kind of made eye contact with the facilitator. One of the facilitators went over and held her hand and helped her work through that, which maybe, took 15 minutes of that individual support, while the other facilitator was able to sit and just monitor and watch over the other participants. So there was a sense of safety that these participants had that enabled them to go inward. And with ketamine, probably as opposed to ayahuasca, for example, it's more likely that the journeyer is very still and very inward focused and not very verbal during the experience.
I love that. Thank you for both giving us you were there and it only happened one time that anybody needed any therapy. That's such an interesting insight. I've only been in a group cap session once. It was my first ketamine ever. And you're right. I don't think anybody talked to anybody. So yeah, that is very different from ayahuasca. And I love if you've been properly prepared. And I think we cannot focus on that enough for everything, right? Like, I don't think we have nearly enough. Think about the ayahuasca retreats most people go to. There aren't generally weeks of preparation beforehand or sessions. So I love that you guys had set that up like that. All right, let's get to the part everybody wants to hear about. What were the results of this cohort?
Yeah, the results are so exciting, Lynn Marie. Like they are just, it's so neat to see. So, um, before treatment, post treatment, again, we measured PTSD symptoms using the PCL6, depression symptoms using the PHQ-9, anxiety symptoms using the GAD-7. And so what we saw was that the PTSD symptoms were decreased by over 58%, reduced by over 58%. And so 100% of our participants did not meet the criteria for PTSD afterwards. The depression symptoms also reduced by over 50%. And let me see if I can find, yeah, so the anxiety scores were reduced by 36%. So, yeah, really exciting, really exciting results. And every participant said in just their subjective report that they benefited greatly from their participation in the project.
Very nice. How many, you said nobody qualified for PTSD before. Had anybody qualified for it ahead of time?
Yeah, and I couldn't tell you the exact number off the top of my head on that.
But it does track with what we do know, or what ketamine research seems to be revealing, is that it's effective for depression. We knew that from a lot of research, showing that it's effective for PTSD, showing possibility that it's effective for anxiety. I think that's anxiety always seems to be like the mixed bag for a lot of even
Mhm.
microdosing. It's like anything but anxiety, right? And so I can't wait till we find more of and it might be psilocybin, something that seems to be really
Oh.
effective for anxiety. But I love that combination, everything did seem to improve at some proportion.
Yep, and I can actually tell you now. So pre-treatment, 60% screened positive for PTSD, and post-treatment, 100% screened negative of these 10 subjects that we have the data on. So yeah, really really exciting results. And yeah, it's so interesting what you mentioned about anxiety. I've thought quite a lot about that because one of the things that happens when some of the defenses related to PTSD are lowered, and some of the numbing related to depression is lowered, a lot of my clients will then experience an increase of anxiety. And I'm not talking about the study, but just in my individual work with those going through ketamine treatments, because they're feeling more. It's like the numbing kind of veil of depression is lifted, and now a lot of emotions are there to be felt and processed through. So some people do actually experience an increase in anxiety when they're doing their healing work. But we have we're a site here in Draper for the MindMed LSD study for generalized anxiety disorder. So there's one that we'll, have some data on soon, and that will be really interesting to see what happens from that study with anxiety.
That would be very interesting. Okay, promise you'll come back and tell us all about it.
Let's
Just
do
gonna
it.
I'm just gonna ask you right now. That's very exciting. Okay, and you said that everybody said they were really glad they went through it. Was there any specific feedback that stands out in your mind from the participants?
Yeah, yeah, absolutely. There's the couple, as I was preparing to talk to you today, I was just trying to see, which individual cases I could remember that really stood out. And there was one that even was kind of bringing tears to my eyes reflecting on this morning. One individual whose fear related to COVID was so great that he had isolated himself from his daughter for months because he was working in a residential healthcare facility, and they would have these kind of COVID outbreaks that were just so traumatizing. I mean, body bags, kinds of things. And so he didn't even touch his daughter for several months in their own house. Um, and by the end of this 6 weeks, he had such a breakthrough with that fear. Um, and I remember him reporting, like, my family is the most important thing on earth to me. And, I don't want fear to come in between me and my connection with my own daughter. So I hugged her for the first time in months, and we have a trip planned. And so that was just such a neat experience. One of our participants that was a therapist came in from this place that is so associated with burnout of, do I even want to do this work anymore? She was like, I don't even know if I want to be a therapist anymore. And by the end of the study, was had gained so much confidence and had been able to access more compassion for her clients again. And she built a private practice. Like, that happened as a result of her working through her burnout in this. And she's got, like, to my knowledge, a full thriving private practice now and loves the work again. Some of our paramedics who probably had some of the most blatant kind of PTSD symptoms, um, including shame and guilt related to the lives that they couldn't save. Um, they had some really neat outcomes from the mystical experience. There was one participant that shared this vision under ketamine of seeing this kind of mystical tree of life. And all of the leaves on the tree were all of the people whose lives he tried to save but couldn't. And they were all just repeating, thank you, thank you, thank you to him. I'm getting chills talking about this. And that really allowed him so much self forgiveness. So yeah, some really, really cool individual transformations that do stand out.
That is a beautiful story. Thank you for sharing.
Mhm.
Did you ask them, was the follow-up done, I'm assuming kind of like soon after the 6th session? And was there any further out follow-up, or is that still ongoing?
1 month. There was a 1 month follow up.
And how so there was immediate follow-up and then a 1-month follow-up?
Yeah, the post treatment. Let me make sure that I'm speaking correctly about this, but I believe that the post treatment was 1 month um, after the participation in the group. So that was our final. Um, the final screenings that we offered.
Because I would be curious to hear how things are after they have gone back to these stressful situations for a while. Like,
Hmm.
so somebody in the ER or an EMT that still has to keep going out. I mean, for the EMT, hopefully they're losing fewer patients to COVID as they were in the beginning. But I'm curious. I even attended a panel at South by Southwest on psychedelics for first responders, where we had a police officer and they were discussing, like, we do this healing and then we send people back out to be re-traumatized every day. And so I'm just wondering, like, how the durability of some of the effects are when they return to the stressful situations.
Yep. Okay. Yep. And I've kind of found here. Okay. So those final measurements that we took were a week after their last ketamine session. So you're right. They did not extend. We did seek subjective feedback a month after the study ended, and quoted in the paper is a good individual answer to your question, I believe, which is that um, so this is a quote from a participant. Directly following the treatments, I had huge improvements in my overall mental health. This has decreased over time, but I believe I am better off now than I was before. So yes, your intuition about that durability is right on, and definitely something that we're thinking a lot about in this world of psychedelic research.
Well, and I think there already is a standard for ketamine where it is one of the ones that we know sometimes needs a booster,
Mhm.
especially that you do, like, even the most common thing is the 6 sessions. And then it does, as most medicines do, life, continues to happen and the medicines get the effects get further away physiologically and even maybe psychologically. You get further away from whatever integration you've done. And there may need to be a booster of many different types, but we definitely know that there is a precedent for that being true with ketamine. And so, I think that says obviously nothing negative about the study, and that's just in line with what we know. And
Mhm.
so, just something for further research. It'll be interesting to see how they respond to a booster and how it, does that make these stressful jobs. Because again, like, the goal is to keep not lose our entire frontline healthcare workforce to burnout, and find a way that we're not just, giving them a one-time band-aid and then they, eventually get back up to their level of burnout, like, to where we can find strategies to moderate that burnout throughout their career. And so I'm very happy that you guys have done this work, and I'm really stoked that seems like other places I know, including Anthony Back at University of Washington, are they're doing similar studies. So
Mhm.
um so what is next for you? You said the LSD trial with MindMed.
Yep. So the LSD trial with MindMed is happening. I'm working as a therapist on that. I am a therapist on an upcoming study by Beckley. That is a 5-MeO DMT study for major depression. So looking forward to that. And yeah, there's a whole lot of psychedelic studies that are going to be coming down the pike in the clinical trial world. But really, in just our clinics, this implementation of more group ketamine treatments is so exciting to me. We started one that I'm not a therapist on, but that is, I think, going to be really neat, which is a group ketamine um, offering for chronic and serious illness that will be structured kind of similarly to the one that we just went over, and some group retreats as well for different indications like addiction, hopefully eating disorder. I'm interested in doing one for postpartum depression. So yeah, that's definitely on the horizon, and something that I think will, like, one, just provide containers with lots of therapy support around ketamine for people who are suffering, and also make this more accessible to people financially.
Yes. Well, big hug for for you and your team doing anything to make ketamine more financially accessible to people. So thank you very much for your work. Really appreciate it. So much appreciate having you on. Where can people find out more about you and your clinics and your work?
Yeah, so Numinous is the name of our clinics here in Utah, as well as the Canadian Bioscience Labs. So anyone interested can look at Numinous or can look up group CAT, K-A-T, by Numinous. I have a private practice called Wild Sunflower Counseling. Anyone interested in that can go to forallthewildsunflowers.com.
Oh, very cool. Hannah, I really appreciate you having come on today and sharing your study with us and all the work that you're doing.
Yeah, thank you so much again, Lynn Marie. And I was there in that same South by Southwest panel that you were talking about with the police officers. Yeah, that was really, really neat. And Anthony.
Yes, and Anthony. Yes. So, yes, cheers to everybody bringing more awareness to the potential of psychedelics for healthcare workers. So, you and the panel and your team, much appreciative from the from the clinician world. All right, for everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.